federal government, through the Affordable Care Act, has offered states the opportunity to expand the Medicaid program. For New Jersey, it would be significant for adults without children would have access to the Medicaid program and get health coverage through that program. Currently, adults without children aren't eligible unless they're very, very poor, which means that they'd have to almost be homeless to be able to be eligible for Medicaid. And so this would expand that universe. It would increase eligibility up to about 130%, 133% of poverty, which means, for a single person without kids, it's about, $12,000, $14,000 a year. For a couple, it would be maybe $30,000, $34,000 a year. They would be eligible. So it's really the working poor. These aren't people who don't work for a living. They work for small companies, small businesses. They could be, your landscaper. They could be the person who works in the car wash or the food store or the convenience store, or they're working for a company that just doesn't offer because they can't afford to. A business with 6 or 8 employees. It could be a butcher shop, it could be the hair salon. Just the people who service us every day with their needs don't have health insurance. And so it would expand it to them. So it would cost the state some dollars, but 90% of the cost would be picked up by the feds. And so that's a great win for New Jersey. There are those who say that's still too much money, but how do you not cover tens of thousands of adults who don't otherwise have access to health insurance and health care? So it's the right moral thing to do. And in terms of the finances, those are the same people who access emergency rooms for their care, and so the charity care responsibility that the state provides to hospitals for relief is in the millions of dollars as well. And so it may offset that cost, but if in the end it costs the state a few more bucks to insure 100,000 people, it's well worth the investment.